Hello and welcome to another episode of your AKT Podcast. I hope that you're enjoying our episode and you're taking lots of valuable learning points away from these podcast episodes. In this episode, you have an elderly housebound patient who presents to you with red sore feet. I would like you to consider which features from peripheral vascular disease would you not suspect in a housebound patient with critical limb ischemia. So before we answer this question, it's really important to consider that critical limb ischemia is a very important condition to consider in any patient who has foot or leg pain, especially in those with significant risk factors. Now, in order to consider this question, we need to look at the features of critical limb ischemia, which can be found in the NICE CKS module for peripheral vascular disease. And as always, I would recommend that you go and have a look at primary guidance. So you would expect rest pain, you would expect night pain, and the patient may also dangle their leg out of the bed to improve blood flow with gravity. And you may also find that as the symptoms progress, that the patient starts to sleep within a chair. Rubor, which is the red discoloration, pallor, reduced capillary refill, skin changes, and absent foot pulses can also be features that are present. The thing that you have to consider is patients with chronic diabetes, where they must have a degree of peripheral neuropathy, or patients who are immobile may not report symptoms of intermittent claudication. Now, chronic diabetes is the one where you may find it's because of the peripheral neuropathy that they can't feel the pain, and the immobility aspect is because the patient isn't mobile enough for the intermittent claudication symptoms to come on. So you should always still consider critical limb ischemia in patients who are housebound. Now, Bergers test is a very useful test that you can use, and I would love for you guys to actually read about Bergers test, because it's more or less where you lift the patient up, leg up, to see whether it becomes dusky. And if it does become dusky, then it means that they have very, very poor circulation to that foot. So I hope you found this helpful, and peripheral vascular disease is indeed quite interesting, and do have a look at the NICE CKS module on this. And if you are finding these podcast episodes helpful, do share them with your colleagues. This podcast is hosted by wellmedic.co.uk. We help GP trainees pass the AKT.